So what procedures does an on-demand dentist do? If we don't do restorative work, we don't do crown and bridge, we don't do recare, what kind of work does on-demand dentists do? Well, it's typically about 80% extractions. That's the bulk of the work we do. The remainder is filled in with pulpotomies. We don't do full root canals. So if a endodontist or a dentist on a Saturday wants to refer a patient to start the root canal, then we can start it and send that patient back to the referring dentist when it's more convenient for the patient and for the other doctor. We also do medicated fill-ins. We will do prescriptions after a patient comes in and does the exam and x-rays and pays for the prescription. We will do prescriptions. We don't do too many of those. We do some deep cleanings as well, but and some occasional re-cement of a crown. And that's pretty much all we do within on-demand dentists. Now, is that enough work to keep a practice functioning? Absolutely. There are a lot of patients out there that are just looking for an extraction. They're afraid to go to the dentist. About 80% of the population has some level of fear of the dentist, and about 50% of the population only goes to the dentist when it's an emergency or when they have a toothache. So about half the population is only looking for a quick solution to a painful tooth. And that's exactly the market that on-demand dentist is serving. And this has been a market that we've been serving for quite a while. Our systems are proven. We've been doing these same procedures for a long time, and we've found zero need to increase the scope of those procedures. Would it be nice sometimes to be able to do a full root canal? Absolutely. But we may lose the trust of the referring doctors if we started to broaden the scope of the procedures that we're actually doing within the practice. So what we've found is we have a very nice balance of procedures that allow us to help a very large percentage of the population that, with very little competition from other dentists and a very high need industry that continues to grow rapidly with the deterioration of the insurance and healthcare fields right now.